Hey everybody, my name's Colin. I'm a PGY3 of the Ascension St. Vincent Internal Medicine Residency, and just wanted to shoot a quick video to provide a resident's perspective on some of the resources and facilities that are part of our regular life here at Ascension St. Vincent, Evansville. So if you come with me, we're just going to do a quick run into the clinic as I sign in for the morning. Beautiful day outside, coming up to the medical office building, which is where we do all of our clinical outpatient continuity clinic work, as well as our ambulatory training. I'm just going to try to spin here. This is our main hospital behind me, specifically the Center for Advanced Medicine, right beside our medical office building. So just coming in here now. To my left, we have our apothecary, which is the outpatient pharmacy. Oh, just got the elevator.
Going up. Going down.
Which brings us to our conference room, where we meet in the morning to have our morning report, where we go over some interesting cases, learning points ahead of the academic teaching day, half an hour blocks of time led by residents in order to facilitate our learning and teaching skills. So now coming out of our morning report educational room, we come into the main flow of our clinic. And to my left here, we have Tristan, who is our post-discharge clinic rock star, keeping everything organized. We work with him about 1 day a week when we're on ambulatory. And then another star of the show here, we have Michelle. So she's our NP, carries a lot of volume with the post-discharge clinic, does a great job of educating us all on the policies, procedures, and also keeps the place running. So we appreciate her, and she's stoked to work with you if you were to join us. And just want to highlight Michelle's room. She's the boss. All right. So coming into the main flow of our clinic here, just step into one of the patient rooms. And this just shows you what they typically look like. So a lot of room, great exam tables. We do have some osteopathic medicine exam tables, which are in a different portion of the hospital if you're trained as of the clinic if you're trained as a DO. And good view, good sunshine. We've got everything that you can need for a physical exam, and gloves, sink, and then all of the materials necessary. We have our monofilaments, we have our tongue depressors, and then of course the sharps disposal and the sanitizer, and we're good to go there. Coming out of our examination rooms, we have a great example of the scholarship that we do like to prioritize here at Ascension St. Vincent Internal Medicine Residency Program. This was a great program by our current chief resident on expanding post-discharge clinic referrals to address specifically the social moral determinants of health. And we did it as a part of our National Initiative 9, which we've continued into the National Initiative 10, a lot of the trajectory that we're doing there. And just to my left here, we have our consultation room where we have our amazing pharmacists. Both Olivia and Bob are in today. Hey guys.
Hi there.
Hi, I'm Olivia. Here we help the residents with all their patients, especially the transitions of care patients like the peri-op and post-discharge patients.
Awesome. And I'm Bob Gold.
Awesome, and they are a very big part of the care that we do here. Continuing back out to the main clinic. And then on our left here, we have one of our workrooms where residents, med student, and an attending are busy staffing. And then to the right here, continuing down the way, we have our amazing medical assistants, Kenzie, the head MA, as well as Sherry, who's been doing some awesome work with us over the last few days, and Dodie, who is a establishment here, helping out with all of the needed documentation corrections for residents, as there are many. And then we have our staff, our stashing room with needed samples for some of the more expensive medications, as well as all of our procedural items for joint injections and all of that side of things. Next up, continuing out, we have another example of the scholarship that we do here, another piece from the National Initiative 9, and here we have our project starting with National Initiative 10 with Dr. DeGore. So coming down, again, we have another workroom. The residents and attending are seeing patients at the moment. Now coming down the other side of the clinic. And I lied to you earlier. I said 22 rooms. I think we actually have 30 rooms. And then here we have another amazing member of our team, Carrie, who helps keep things organized, on track from an outpatient request standpoint. It just kind of helps minimize all of our inboxes by streamlining a lot of the requests at the point of contact. And then we have Barbarina and Abby, who are our two fearless leaders from an administrative standpoint. Appreciate everything that they do, keeping everything running. And then Kenzie, who is our fearless front desk staff, making sure that everything is organized, on track, and safe for the rest of us.